Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this telephone town hall in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
AARP, a non-profit, non-partisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. While the COVID pandemic has largely receded from the daily concerns of most Americans, it continues to be a threat for older adults. In fact, since January 1st, the U.S. has experienced an average of more than 500 COVID-related deaths each day, with almost 90% of those among people ages 65 and older. Nearly 3 years after the pandemic was announced, we are also learning more about the long-term health and psychological effects of having had COVID. And misinformation about COVID-19 and vaccines persist, stirring confusion and reluctance by many to protect themselves and their loved ones. Today we'll hear from an impressive panel of experts about these issues and more. We'll also get an update from Capitol Hill on legislation affecting older adults. If you've participated in one of our teletown halls in the past, you know this is similar to a radio talk show, and you have the opportunity to ask your question live. For those of you joining us on the phone, if you'd like to ask a question about the coronavirus pandemic, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. And if you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion about the continuing effects of COVID-19. We're talking with leading experts and taking your questions live. To ask your question, please press *3, and if you're joining on Facebook or YouTube, you can post your question in the comments section. We have some outstanding guests joining us today, including experts in epidemiology, behavioral sciences, and online misinformation. We'll also be joined by my AARP colleague, Jesse Salinas, who will help facilitate your calls today. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member, or if you're joining on Facebook or YouTube, drop your question into the comments section. Now I'd like to welcome our guest. First is Katie Passaretti, MD. She is the Vice President and Enterprise Chief Epidemiologist at Atrium Health. Welcome back to our program.
Delighted to be here.
All right. We also have Angelina Sutin, Ph.D. She's a professor in the Department of Behavioral Sciences and Social Medicine at Florida State University College of Medicine. Welcome to the program, Dr. Sutin.
Thank you so much. I'm excited to be a part of the conversation.
All right, we're excited to have you here. And I'd also like to welcome Peter Adams. Peter is the Senior Vice President of Research and Design at the News Literacy Project. It is a nonprofit, nonpartisan organization that helps people recognize fact-based news in order to trust, share, and act on accurate information. Welcome to the program, Peter.
Thanks so much. It's great to be here with you.
All right. It's great to have all of our experts today. I think it's going to be an excellent program. And just a reminder, to ask your question, press *3 in your telephone keypad or drop it into the comments section on Facebook or YouTube. All right, let's get started with you, Dr. Passaretti. As I noted at the top of the program, the U.S. is seeing more than 500 deaths each day from COVID infections, and of course, nearly 9 in 10 of those are adults 65 and older. While many say the danger of COVID has passed, that's not the case for older adults. How do they protect themselves from severe infections and possibly hospitalization?
Yeah, certainly we're at a very different point than we were almost 3 years ago, but COVID still impacts us, and in particular the individuals that are over the age of 65. You know, the tools to protect ourselves haven't really changed in some time. You know, certainly, especially if you're a higher risk individual, over 65, weakened immune system, combo of that, multiple medical problems, being up to date on your COVID vaccines as well as all of your vaccines is certainly, you know, a big step in protecting yourself and preventing severe disease. You know, in addition, I would say be aware of what's going on in your community. Are you seeing an increase in cases where you might want to be a little bit more careful than you were when cases are low? And that means, you know, making sure you're washing your hands regularly and potentially using a mask if you're in a high-risk, really crowded situation, and there's a lot of cases in the community at that point in time. The other thing I would say that is really important and different from where we were a couple of years ago is that we do have treatments that are easier to take now that are available. So Paxlovid being one of the predominant ones that you can take by mouth. So if you do start to get sick, if you know you were exposed, erring on the side of talking to your doctor sooner rather than later, getting tested, or, you know, taking the medication they prescribe if you have COVID. The earlier you take that medication, the better, you know, protection that you have.
Okay, thanks for that, Dr. Passaretti. And let me follow up. In January, the U.S. Food and Drug Administration recommended a series of changes, including an annual COVID shot to simplify prevention for Americans. What are the changes that were recommended, and when can we expect them? And what about for those who are immunocompromised?
Yeah, so the FDA did meet at the end of January to talk about, you know, where are we going? Everyone acknowledges that COVID vaccines have been incredibly complicated. You know, the whole primary series, boosters, who takes what, immunocompromised, it's just very confusing for people. So there's for sure benefit and need to simplify what the recommendations are moving forward. And that's kind of what the FDA came to the table to discuss. I will say, while they voted on one particular change, so in the past, if you're completely unvaccinated, the recommendation was to use the initial vaccine, the monovalent vaccine, and they said, you know, no more of that. Now, if you're not vaccinated, whatever dose of vaccine that you need, you go ahead and do that newer bivalent vaccine. So that was what they approved. However, during that conversation, the things they discussed were simplifying the vaccine regimen, considering going to an annual shot for COVID and, you know, around the time of quote-unquote typical respiratory viral season like we do for flu, and updating the COVID vaccine based on variants that are circulating around the time that we've learned that the peaks tend to occur. So, you know, I think there's further discussion on those, but certainly headed in that direction of simplification, moving towards an annual COVID vaccine in addition to annual flu vaccine, at least for those individuals who are higher risk, like 65 and over. For immunocompromised patients, similarly recommended going to that bivalent vaccine, and there, again, with some discussion but not finalized, whether those highest of high-risk individuals may get vaccines more frequently than annually. But again, that hasn't been finalized. They're still kind of working with all the experts in the FDA and infectious disease world to come up with final recommendations.
Okay, very good. Now, you mentioned the bivalent COVID vaccine. Last month, the FDA and CDC identified a possible safety issue with the bivalent vaccine for older adults. What do we know about that and what caused it?
Yeah, so there are a number of different kind of ways to collect information on potential vaccine adverse events, different databases, different ways to pull information together. So in one particular database, the VSD, they noted a signal for increased risk of stroke in individuals that were over the age of 65 soon after they got the bivalent Pfizer vaccine. So very specifically that population. So what you do, and that's just a signal, that's like, is there, there may be something there, we need to look at it further. Looking at all the other ways that we collect information on vaccine adverse events, that same risk didn't float up to the top as something that seems that the data supported was a significant concern. In addition, it was only seen with Pfizer in that one particular database, not Moderna. So, a lot of supporting evidence that signal may not be clinically significant, but, as has been done throughout, since vaccines have been available for COVID, we want to, because it is a newer vaccine, make sure that we're making sure that there are no adverse events that can be directly tied to the vaccine where recommendations need to be changed for a particular population or in general.
And so if you were advising somebody who's 65 or older thinking about getting the bivalent vaccine, would you steer them away from the Pfizer vaccine, or would you simply monitor them more closely than you normally would?
Yeah, I think the bulk of the data suggests that signal is not a clinically significant signal. So I think, certainly if someone's more comfortable, Moderna is a perfectly fine vaccine. I would still what I would encourage them not to do is say, okay, I'm not going to get my booster shot. I don't think that's the right thing to do. Certainly, and I think Pfizer is fine. If you're more comfortable taking Moderna, also perfectly fine, but just get your bivalent booster. Okay,
very good. Thank you, Dr. Passaretti. It's now time to address your questions about the coronavirus infection with infectious disease expert Dr. Katie Passaretti. Please press star 3 at any time on your telephone keypad to be connected with an AARP staff member to share your question live. And if you'd like to listen in Spanish, press star 0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
I'd now like to bring in my AARP colleague, Jesse Salinas, to help facilitate your calls today. Welcome, Jesse.
It's so good to be here today.
All right, Jesse, who do we have first on the line?
Yeah, well, our first call today is going to be Dan from Pennsylvania.
Hey, Dan, welcome to our program. Go ahead with your question.
Oh, okay. I had tested positive on Wednesday, February 8th, and I'm still positive 8 days later. Would Paxlovid help at this point?
Dr. Passaretti, would Paxlovid help at this point, 8 days in?
No, 8 days in, you're unlikely to get any additional benefit from taking Paxlovid at that point. And, the important thing is if you're symptomatically improved. So the antiviral medicines, most useful within the first 5 days of symptom onset. Beyond that, really diminishing returns on impact on how you're feeling.
Okay, very good. Jesse, who do we have up next?
Yeah, our next question is actually going to come from YouTube. It's from somebody named Cuddy in Arizona, and they're asking, are expired COVID home tests still good? I have 4 tests at home that have not been used.
Expired COVID home test. What do you think, Dr. Passaretti?
Yeah, so I would say they did extend the expiration date on some tests. There is a website where you can go and check if your particular brand, the FDA has a website where you can check if your particular brand is one of those where you can still use the test past the expiration date. It depends on how long and what brand of test you have.
Okay, very good. Let's go back to the phone lines, Jesse.
I'm going to bring in Terry from L.A.
Hey, Terry, welcome to the program. Go ahead with your question.
Good afternoon. I'm wondering if there is treatment available for long COVID in the Fredericksburg or Washington, D.C. area. Fredericksburg, Virginia.
Yeah. Dr. Passaretti, maybe you can talk a little about what we know about long COVID, what the symptoms are, and what the treatments are, if there are any.
Yeah, unfortunately, long COVID is something we are very much still in the phase of learning about and learning what works best. It is even defining exactly what long COVID is. The symptoms that have been attributed in different places to long COVID range from brain fog, fatigue, to breathing problems, to heart problems, and everywhere in between. So I think, unfortunately, there's no one easy answer. I would strongly recommend kind of talking to your local physician and seeing what resources are available for treatment of long COVID. But just know it often is individualized based on your particular situation and symptoms, and that, it is definitely something we are still learning about at this point in time.
Okay, thanks for that. Let's go back to the phone lines. Who's up next, Jesse?
We're going to bring in Pamela from Wisconsin.
Hey, welcome to our program. Go ahead with your question.
Yes, I have a COPD really bad. And I'm 73 years old. I was told that if I get COVID, that I would more than likely die because of my breathing problems. However, I was in the emergency room not too long ago, and I said something to someone about that, one of the healthcare providers, and they said that's not true anymore. You more than likely would not die. Now, I am extremely careful, and I get all my shots. I wear a mask all the time, but I'm getting conflicting information now. I mean, he said that, you would not die now.
Well, let's ask about that. Dr. Passaretti, have the treatments improved to such a degree that somebody with COPD is in less danger?
Treatments have improved. The virus has changed over time, and there's some indications that all these, different strains of Omicron variant that have been circulating since January of 2022 is maybe associated with less severe disease. So I do think, we're in a different situation. Does that mean every patient experiences that? Absolutely not. We still see patients every day in the hospital on ventilators having, significant illness and, unfortunately even dying from COVID. So certainly the risk seems to have decreased over time, but it's not non-existent, and it's not something that you can say for sure, a person with severe COPD, many risk factors will be fine if you get it. And, it sounds like this caller is doing the smart stuff, getting vaccinated, making sure she's protecting herself as much as possible. So risk is lower now, not gone all the way, not something we can completely blow off. Okay,
thanks for that. And as a reminder to our listeners, if you'd like to ask a question, press *3 at any time on your telephone keypad to be connected with an AARP staff member and share your question live. If you're on Facebook or YouTube, you can drop your question into the comments section. Jesse, who do we have up next?
Yep, we're going to bring on Mary from Illinois.
Hey, Mary, welcome to our program. Go ahead with your question.
Thank you for taking my call. I'm not a scientist, but I have been keeping up with the research, and I just want to clarify a point. I understood the doctor to say that there's no decision that has yet been made relative to next steps after the initial bivalent booster. However, I had thought that there was the intent to consider an updated booster that would be administered more frequently than annually for those that are immunocompromised and the elderly. And having read some research on the success and the vaccine effectiveness of the bivalent booster, my understanding is that it significantly wanes after 3 months with people 65 and plus. So can you either reaffirm what I just understood you to say, or tell us whether or not you understand there's work in progress in the pipeline to make sure that people are not going to be without booster coverage?
Dr. Passaretti, can you take that on?
Yeah, absolutely. So, yes, the FDA discussed every single thing that caller just said, updating to reflect the variants that are circulating over time, doing that more in proximity to the surges of COVID that we see in the future. And again, the caller very smartly called out that, we have seen, and there are now multiple studies that show the protection from the COVID vaccine. And, honestly, that's the same with many vaccines. You have the most protection soon after you get it and for the first couple months, and then it decreases over time from then. So around 3 to 6 months, you see decrease in the amount of protection against symptomatic illness. Now, you still have some benefit on more severe illness. So yes, absolutely, the discussion is currently, although the FDA has not voted on it yet, to update the vaccine to reflect current strains, at least annually, and potentially more frequently for those that are of highest risk. Those decisions haven't been finalized at this point in time.
That's what they do with the flu vaccine each year. But what I know about the flu vaccine is sometimes it's more effective than other times because of the different nature of the way the COVID vaccines are created. Would they likely be more effective consistently?
Well, exactly. Same kind of scenario as with flu vaccine. It takes time to ramp up vaccine production. You have to pick the strains and kind of try to predict the future. And sometimes we do a good job of that and the virus is more kind of stable, and sometimes less good job. So as you said, with the flu vaccine, sometimes we hit the mark pretty well, sometimes a little bit less so. So it will likely be the same thing with the COVID vaccine. We've seen how many variants and subvariants have occurred over the past couple of years. And, as much as scientists do their best to predict the future, sometimes it's not perfect.
Okay, thanks for that. Let's take another question. Jesse?
We're going to bring on Dan from Colorado.
Hey, Dan, welcome to our program. Go ahead with your question.
I know several family members who have had COVID several times, and I understand that there's an increased risk in the future. What are those risks if that truly exists?
Dr. Passaretti, what about people who have had COVID more than once? Do they have increased risks of getting it again, or long-term symptoms?
Certainly there is some data that certain things can reduce the risk of long COVID. Vaccines have been associated with a decreased risk of long COVID. Getting treatment with Paxlovid in some individuals was associated with a lower risk. And even the type of COVID virus variant you were infected with may play a role in your risk of kind of longer COVID. Susceptibility to COVID depends on, your social habits and exposures and health status and all that kind of stuff. It's not that, if you're infected once, you're likely to get infected again. It's whether you're put in that situation, your immune system kind of level to fight off things, that kind of thing.
Okay. Thanks for all of those questions. We're going to take more questions from our listeners shortly. And remember, if you'd like to ask a question, press star 3 on your telephone keypad. Now let's turn back to our experts. Dr. Passaretti, President Biden said that the public health emergency around COVID is going to end in May. Does this change testing or treatment options going forward? And how will things be different for consumers at that point?
Yeah, so, we're still figuring out all the implications of the public health emergency going away on healthcare and whatnot. But what we do know is that the public health emergency kind of allowed the government to give, many of us got free home tests from the government. Vaccines were at no cost for individuals. Treatments were at no cost. So with the removal of that public health emergency status, there is the possibility that individuals may have to pay for those, or that it will go through their normal insurance process. Now, Medicare, Medicaid, private insurance will cover those things, but, a big deal for individuals individuals that are self-pay or lacking in insurance. So, everything will still be available. It's just changes in free access to it.
Yeah, and some of those tests, those home tests, aren't cheap.
They're not cheap, yeah, absolutely.
All right. Let me ask you this. The FDA withdrew authorization for Evusheld recently. It's the brand name for a monoclonal antibody. What did FDA take? Why did they take this action? And wasn't this important to those people who are immunocompromised?
Yeah, so Evusheld is a monoclonal antibody that was given to kind of prevent infection in individuals that aren't able to kind of mount their own immune response, so those immunocompromised individuals. Unfortunately, as we've seen with many monoclonal antibodies, there have been a number of treatments. As the virus evolves, those antibodies are working on certain kind of parts of the virus, so as there are different variants, those treatments have become less effective. So Evusheld, similar risk because it no longer was the type of virus that's causing infection, circulating in our communities, Evusheld doesn't work for. So that's why it's been removed. There is work to kind of update, as you said, people who are immunocompromised, they're not able to fight off infection the same as everyone else. So, there is work to see if there is a new type of treatment that can help prevent illness. But right now we have a gap there.
Got it. Thank you very much, Dr. Passaretti. Now I'd like to welcome Dr. Gina Sutin to the conversation. Gina, you're an expert in behavioral science. Your recent study found the pandemic altered personality traits in younger adults. Can you tell us more about that?
Yes. So we were fortunate to have the opportunity to use a large sample of adults who had their personality measured both before the pandemic and during the pandemic. So these were the same participants. They filled out the same standard personality measure. So we could compare them to themselves to see if their personality had changed from before to during the pandemic. And what we found was that for younger adults, there was an increase in neuroticism, which that is the tendency to feel negative emotions and to have a sensitivity to stress. And they also decreased in agreeableness, meaning that they became less trusting, less straightforward, a little bit more antagonistic. And they also showed a decrease in conscientiousness, which is they became less responsible, less organized, and less disciplined.
Oh, well, and I assume all of those were statistically significant because some of our listeners may be thinking you just described a pretty typical teenager there.
Yeah, and as I was saying that, it's like, this is like adolescence. But yes, these are statistically significant changes.
Okay, and we were able to connect them to the pandemic and the conditions around the pandemic. Was it related to the underlying disease itself, or was it also the conditions of isolation people experienced?
So that is a really good question that we're still trying to tease apart in terms of, is there something about having had COVID that would lead to personality changes, and in addition to, as you said, the social conditions, the isolation, the fear and anxiety around the pandemic. We don't know exactly what it was about the pandemic that contributed to these changes.
Well, let me ask you, how does this impact families? What can parents or grandparents do if they've seen changes like this?
Yeah, so the first thing, I'd like to put these results into context. So when we look at the personality changes, this is average changes across the group that we looked at, which means that some people might have increased, some people might have decreased, but on average, there were these changes. So what this means for people listening, they may hear this result and think, oh, yes, I saw this in my child or my grandchild, and it really resonates. And others might hear this and think, well, I didn't see any of these changes at all. I just want to point out that both of those experiences can be true. These are average changes, so they might not be specific to any specific individual. But to answer your question, one reason we care about personality is because specific traits can increase vulnerability to mental health issues like anxiety and depression. or they increase unhealthy behavioral patterns, which can be, anything from substance use to not showing up to work on time or procrastinating assignments. So what I suggest is rather than focus on change in personality, it's more helpful to pay attention to behaviors that might be problematic. So, for example, with an increase in neuroticism, there's nothing wrong with feeling a wide range of emotions. It's when those negative emotions become overwhelming or difficult to control that it can be helpful to intervene. Another example is that, maybe somebody who has a small social circle, having a small social circle is, not problematic. But if you notice somebody becoming more withdrawn from family and friends, that could indicate loneliness or depression, and that would be, worth addressing and intervening. So rather than thinking about, changes in personality, think about, what are the behaviors and emotions that you're seeing in your children or grandchildren.
Right. Now, of course, your research focused on younger people. I wonder how have the norms and behaviors as our society writ large been challenged as a result of the pandemic? And what have you seen with older adults?
So we did look at personality in older adults, and we found very little effect of the pandemic on the personality of older adults. They seem to be, at least in terms of their personality, very resilient to the pandemic. More broadly, I think what we're seeing now is that people are individually deciding what is their new normal and what they are comfortable in doing as they adjust to, life post-pandemic.
Yeah. Well, let's talk about that. How do we move forward after the pandemic? What are the traits and personality skills that help people cultivate their health and a sense of well-being?
Well, there are many traits and skills to focus on that can help improve health and well-being. The good news for older adults is that with age, neuroticism tends to decline and conscientiousness tends to go up, and those are both really good traits to help maintain health and well-being. I have two suggestions for kind of what you can do to, from a psychosocial perspective, improve health and well-being. And one is to remember to stay socially connected and engaged. I think we hear this a lot, but it's important and worth repeating that social connection is really important for health and well-being. And then my second suggestion is to cultivate a purpose in life, which is the other area that I study. And what we know is that purpose can be cultivated at any age. It does not need to be something that is grandiose or lofty in any way. It can be small things that help make life feel more meaningful. And there are all sorts of health benefits associated with it. It decreases risk of dementia, cardiovascular disease. It's even associated with greater longevity for people living longer. So my suggestion is to stay socially connected with others and to try to cultivate your purpose in life.
Well, I love your point about cultivating purpose in life even later in life, and we can help with that at AARP. We have so many volunteer opportunities available in communities all across the country. You can find out about on our website at aarp.org. We also annually sponsor a Purpose Prize, which actually rewards people who have, found purpose later in life and maybe, started a nonprofit or a business or just tried to help people in their community. And these awards are just so inspiring. The things that people are doing in their 60s, 70s, and 80s is just really remarkable. And so I really love that suggestion. Thank you so much for that, Gina, and thanks, Dr. Passaretti, as well. Let's take a moment right now and get an update from Capitol Hill. To do that, I want to bring in somebody who has found a great deal of purpose in her life. That is Catherine Sevier. Catherine is a registered nurse and doctor of public health. She is also the immediate past state president of AARP, North Carolina. She is going to be sharing how AARP is fighting to strengthen Medicare and your health. Welcome to the program, Catherine.
Thanks, Bill. I'm happy to be here.
Well, we are delighted to have you. Now, starting January 1st, there were some important changes to Medicare that took effect, in particular to control the skyrocketing cost of prescription drugs. Can you talk about that?
Yes, very happily. After decades of calling on Congress to make prescription drugs affordable, AARP won the fight to let Medicare negotiate drug pricing, and for the other policies it'll save us seniors money on our medications. For example, the new law caps the cost of Medicare covered insulin at $35 a month, which is huge, and it eliminates the out-of-pocket cost for most recommended vaccines under Medicare. One that's quite pricey is the shingles vaccine. Also, drug makers are going to be penalized if they increase prices faster than the rate of inflation. Beginning in 2025, which will be here very quickly, there will be a limit on how much Medicare Part D plans pay beneficiaries, how much we have to pay out of pocket for our prescriptions. It's initially being set at $2,000 a year. So all of these changes are ones that AARP has fought for years and will save Medicare beneficiaries and taxpayers billions of dollars.
Well, that's fantastic news, Catherine. Can you talk a little bit about why this is so important to you and to older consumers who are in Medicare?
I'd be glad to talk about that. One of the things that we hear most from our members is the frustration and desperation that comes from trying to afford skyrocketing prices of prescription drugs. The most common reason that older adults get medications or ration medicine is because they can't afford it. As a practicing nurse, I saw this so often, and the consequences were life-changing, really life-altering for many people. So these cost savings will save lives. They'll put money back in seniors' pockets at the same time that they're struggling. And it will help them to afford the rising cost of medicines and be able to turn more of that money to their basic needs.
Okay, very good. I wonder if you could talk about some other health improvements that AARP is fighting for.
So one of the things that we cared passionately about and fight for is help for family caregivers. And we're working to provide seniors with greater access to home care and more broadly for nursing home protection. We're working for broader Medicare coverage on dental, vision, and hearing care. And for years, we've been advocating for more affordable hearing aids. And as a result, a lower-cost hearing aid option is now available for those with moderate hearing loss. We're also continuing to advocate to allow greater use of telehealth. We're working to solve senior hunger. We're advocating for better mental health coverage, and I was just so interested in what we were just talking about with that, and expanded access to affordable health care.
Okay, well, that's a pretty weighty portfolio and all very important. Before I let you go, Catherine, Medicare and Social Security have been in the news a lot recently with the mention of possible benefits cuts. What's AARP saying to Congress about that?
Well, we're saying no way. It's outrageous to suggest cutting Medicare and Social Security. We expect Congress to protect our benefits, to protect the benefits we've worked so hard for. And we were very encouraged the other night to hear a commitment to protecting Medicare and Social Security from leaders in both parties. That included the president, former President Trump, Speaker McCarthy, the Majority Leader Schumer, Leaders Jeffrey, and many others. These are programs that are so critical to older Americans that we need to keep saying and raising our voices and saying no.
All right. Thank you very much. Now, Catherine, if listeners want to stay on top of AARP's advocacy news, how can they find out the latest?
Well, we encourage everyone to go online to aarp.org/get involved and sign up for the AARP Advocate. The Advocate is a free monthly e-newsletter, and you receive email alerts as well and the latest advocacy news. So again, it's aarp.org/get involved, and it's an easy way to make a difference.
Okay, thanks so much for that, and thank you for your many years as an AARP volunteer representing the voices and priorities of North Carolinians.
Well, thank you, Bill. And I want to say thanks to all my other volunteer colleagues who are out there. It's our persistence and commitment to aging well that makes a difference. And we're the folks that are out there making AARP relevant to people as they age. And so keep up the good work, friends.
All right. Thanks so much, Catherine. And to our listeners, I had mentioned earlier ways of AARP can help you find purpose through volunteering. I want to give you a way to find out more about that. You can look at our website at volunteers.aarp.org. I also mentioned our Purpose Prize competition every year. And the deadline for 2023 is approaching. It's the end of February. You can find out more about that at purposeprize.org, purposeprize.org. Now it's time to address more of your questions with Dr. Katie Passaretti and Dr. Gina Sutin. As a reminder, press star 3 at any time on your telephone keypad to be connected with AARP staff and ask your question live. Jesse, who do we have up next?
Yeah, we're going to take a question from Facebook. This is Jacqueline Wims, and she says, I'm fully vaccinated and boosted. I've never had COVID. I always wear a mask in public and around friends. What suggestions do you have on how we create a different, quote-unquote, new normal for dining out, concerts, and other activities? What about a friend's house? I limit my activities these days to grocery shopping and outdoor activities only.
Dr. Passaretti, it's kind of hard to know what is normal these days. What do you suggest?
Yeah, it's a really good question, and one I think we're all struggling with as we hopefully transition out of the pandemic to treating COVID like a regular respiratory virus. I do think for a bit longer it's going to involve keeping an eye on the cases in your community and, pushing on the tools we have to kind of prevent illness, whether that's masking or limiting your large group kind of gatherings and whatnot at times when cases are high. I do think, again, we're at a different point than we were a couple of years ago, that you can get out and about a bit more comfortably, safely with using those tools. Having said that, I understand, it is challenging because most people are not wearing masks, and, there's a lot of challenges with mask wearing and different opinions on mask wearing that is limiting. But I think, we have the tools to protect ourselves. We have information we can tap into to kind of assess risk. And as when we're using all the tools that we have, I think that can do a decent job of protecting us. I suspect we're going to continue to have curveballs primarily, hopefully, during our typical respiratory viral season, where we may need to ramp things up for a longer period of time.
Okay, thanks very much for that. Jesse, who do we have up next?
Yeah, we're going to take Gina from New Jersey.
Hey, Gina, welcome to our program. Go ahead with your question.
Well, my sister has long COVID, and she seems to be getting more and more depressed. And I read about what Dr. Gina, you were speaking to earlier, said that it causes personality changes. And I'm really concerned about that because she just seems to be angry. She doesn't want to talk to anybody in the family anymore. She's not addressing it. I've nagged my brother-in-law to address it. But they seem to be in denial. Is there anything that can be done for these personality changes?
Yeah.
Or is it permanent?
Yeah, that's a great question. Gina, can you address that?
Yeah, that is a great question, and unfortunately, we don't know the answer to that yet. We need more time and more data to see whether these personality changes that we found are lasting, or whether personality is resilient and it's going to bounce back. But in the meantime, we do have mental health therapies and treatments that can be helpful for depression and anxiety and anger. So, doing the best to be able to connect your loved one with those resources is, I think, the best you can do right now.
Yeah. Gina from New Jersey mentioned denial, and I know these are difficult topics for people. How would you suggest starting a conversation like that with either the person who is depressed or the other family members?
Yeah, well, I think it starts with empathy and with, trying to understand what the person is feeling, rather than coming to them with, I see this is happening to you, we need to do something about it, which I think is often, people want to be the proactive problem solver. And sometimes it really starts with talking and empathizing with what the person is going through. When you create a kind of intimacy that can lead to opening up and, be more receptive to getting treatment.
Okay, thanks so much for that. And thanks for all those questions. Remember, if you'd like to ask a question, press *3 on your telephone keypad. Let me turn back to our experts. Gina, throughout the pandemic, we've seen efforts to shape public opinion for and against the vaccines. I wonder if public health messaging is more important than actual data that shows the effectiveness of the vaccines in terms of shaping people's behaviors.
Yes, absolutely. You can have the most effective vaccine possible, but it's not going to matter if people don't take it. And that's, really where the messaging comes in, to meet people where they're at and give them the information that they need. And those messages might be different for different populations. And so that, good public health messaging is going to be very important going forward.
Yeah. Well, now I'd like to welcome to our program someone who knows a lot about COVID information and the importance of good information. That is Peter Adams. Peter is the Senior Vice President of Research and Design at the News Literacy Project. Peter, you've studied misinformation and disinformation related to COVID and the vaccines. Can you provide some examples of the messages and tactics used to undermine the vaccines? And can you tell us if they're working?
Sure. I think the biggest takeaway here is that there are so many examples and messages. There are so many false claims and disinformation narratives out there. So, to be clear, vaccine deniers and anti-vaccination propagandists have a long history of trying to attach their messages to everything they can, right, including, trying to connect the vaccines to every negative news event possible. So that's driven just a huge number of harmful and dangerous falsehoods, specific claims, but also just overriding narratives that we've seen since the beginning of the pandemic. It started out, if you remember back in 2020, that the whole thing was a government hoax, that it was being staged, that hospitals were actually empty, that all the doctors and nurses who were on the front lines risking their lives and spending unbelievable amounts of hours serving the public were actually faking it, to the point where people showed up at hospitals with their cell phones trying to prove this conspiracy. There were lots of rumors about the fact that this was somehow designed to increase the public tolerance for government regulation, to alter the food supply. Long-standing conspiratorial narratives about some kind of new world order, about microscopic trackers in the vaccines, or that 5G technology caused COVID and everybody was covering it up, or that the vaccines would alter your DNA. And those have kind of fallen away. They were effective for a time among some folks. They took root. They kind of festered and died down and died out. And they've moved on to other things. So right now, I think the most pernicious disinformation narrative is that the vaccines are not just unsafe, but are actually causing deaths. And I think that's something we've seen over and over again. And every time a prominent person passes away. We saw it with Hank Aaron and Betty White and Colin Powell and Queen Elizabeth. They jump online and say that, it was due to the vaccine somehow. They did the same thing when Damar Hamlin, the Buffalo Bills player, collapsed on the field. And so that's sort of the latest and most alarming trend that has kind of stuck around with us here.
Well, let's talk about that. I mean, when I too have heard those incidents you mentioned, and oftentimes they're associated with the phrase "they died suddenly" to suggest that the vaccine had a role in the person's deaths. What's going on there, and what's the impact of messaging like that?
Well, the impact, and this is what makes it so effective, right, is to really target people's fears, their deepest fears about the people they love, coming into some kind of harm, and to really exploit the uncertainty that I think is just born out of the fact that this is a very complicated event. Not only how COVID works, how it attacks the body, but also how the vaccines work, how mRNA vaccines work. And they're exploiting that complexity and that uncertainty as well. And I think, people passing away suddenly, I think that theme and that narrative and that phrase has come from a 2022 propaganda film that was made in a kind of documentary style that was called "Died Suddenly," and that made the rounds online. There have been several, right? There was another one called "Plandemic" that pushed that idea that hospitals were actually empty, and that sort of got that phrase rolling and got people sort of looking for any instance of an unexpected or sudden death. And of course, there have always been sudden deaths. Athletes collapse on the field during practices and games more often than you think, all across the country, from high school to college to professional to recreational sports, and people don't pay attention. But now they have something to hang that on, and they'll draw attention to it. So it seems really compelling. And "Died Suddenly," by the way, used a lot of footage out of context, so years old footage, years before the pandemic even started, and tried to sort of edit those back to back to make them feel really compelling.
Yeah. Well, the question I have is why? I mean, why do vaccines continue to be a lightning rod for misinformation? I mean, the fact is there's no scientific information really questioning vaccine effectiveness, but we saw a recent Rasmussen poll that found 1/2 of Americans believe COVID-19 vaccines may be to blame for unexplained deaths, as you were just saying, and more than a quarter say someone they know could be among the victims. So what's going on here? Why are these beliefs so widespread?
Yeah, I think, as I mentioned, it's not only, complex subject matter that involves, getting a shot in your body. That's a physical, very, very tactile, emotional sort of thing that someone can message around. But also I think it taps into a few things. I think it taps into a lack of scientific literacy, as I mentioned, not just about epidemiology and how viruses work or exactly how vaccines and antibodies work, but also a lack of understanding of scientific evidence, of the process that vaccines have to go through, of how medical trials work, and how that evidence has mounted, and also the nature of scientific consensus and how strong a signal that is for folks. And then I think on the flip side, too, I think it also taps into really widespread and longstanding cynicism and distrust of government agencies and authority. That, this idea that no one in charge of a government agency has your best interests at heart, that everyone's up to something, that everyone has some kind of secret agenda or ulterior motive. That kind of conspiratorial thinking, I think, is quite alarmingly prevalent. And is actually, harder to resist than we might think, right? Conspiracy theories and conspiratorial narratives actually meet important psychological needs that we all have. People have a natural drive to seek safety and certainty. We prefer simple explanations with clear good and bad sides to them. And we're also soothed by the idea that our understanding of the world is accurate. And then everybody seeks a sense of community. So some of these groups really, again, they try to exploit people's deepest fears for themselves, for their children, for their loved ones, and just open an aperture of doubt and then work at that aperture over time and broaden it into full-blown doubt and denial. And they've been doing this for years, but this has been their most tremendous opportunity with COVID.
Well, and of course, some of the folks spreading that misinformation are right within our own families or loved ones, right?
Yeah.
What is the best way, do you think, to talk to a loved one and friends to inform their views if they're sharing misinformation and conspiracies about vaccines?
Yeah, that's a great question. I think number one, keeping those things I just mentioned in mind. Sort of why these things appeal to people. And it makes sense if you see something, especially visual. If you see video of someone collapsing, it affects you, right? You have a strong emotional reaction by nature, almost before your critical, rational faculties can catch up and pause and say, "Wait a minute, how do I know where that was, what that is, what the context is, what the source is?" So it's important to sort of emphasize that and empathize with people. We advocate for something called a kind of pep talk approach, which stands for patience, empathy, and persistence. So just, have patience with your loved ones, have empathy, and be persistent. Realize that it may not just be one conversation. You're a trusted intermediary. If one of your loved ones is saying something like this, you're actually uniquely positioned to help change their mind, but that change might happen over time. These beliefs might be tied up with other things, other aspects of their identity.
Yeah.
And so it just takes time. I also think it's important to frame misinformation as fundamentally exploitative, right? Some people defend misinformation that upholds their values and beliefs, but it actually seeks to exploit our most deeply held and sacred beliefs and values. It attacks our patriotism. It uses our commitment to equality or our religious faith against us. And then to kind of, sneak false information past our cognitive defenses. So we have some great resources on our website at newslit.org, including an infographic that's called How to Speak Up Without Starting a Showdown that you can find at newslit.org and download. Right. That'll give you some guidance, too.
I'm going to check that out, newslit.org, and I loved your rules of thumb: patience, empathy, persistence. It's a pep talk. I'm going to keep that in mind for other parts of my life as well. Thanks so much for that, Peter. Now it's time to address more listener questions with Dr. Katie Passaretti, Dr. Gina Sutin, and Peter Adams. Press *3 at any time on your telephone keypad to be connected with AARP staff and get in the queue to ask that question live. Jesse, who do we have up next?
Yep. The first we're going to start with is Caroline in Texas.
Hey, Carolyn, welcome to our program. Go ahead with your question.
Okay, my question is also mostly a comment, and he just kind of answered it. He gave me some information, but I was at my primary care doctor's office last week, and, he's kind of like a family physician, and a lot of the misinformation, I think, or the messaging is coming not only from the media and those groups that he was talking about, but my doctor even said to me that the vaccines are causing problems with people under 30, and especially with the male population. And when my grandsons hear this, their parents, they don't even want them to take any more of the vaccines. So my question was going to be, where could we go to really get some information about this? But it's also being spread by some of these medical doctors.
Yeah, that's a really interesting point. I actually wonder if Dr. Passaretti wants to weigh in on that. What would you say to Caroline and others who have heard this sort of thing from their own physicians?
Yeah, it is challenging for sure. There are trusted sources of information beyond, I always try to say, go to your primary care doctor, and, it's on us to some extent to make sure that we're giving your primary care doctor the tools that they need to be able to give accurate information. There's been a lot thrown at physicians over the past couple of years, and certainly particularly with the vaccine, information has changed over time. So I think as much as we can do to educate not just the public but our colleagues and physicians and ensure kind of common messaging across all different areas, it is super important. And acknowledging that physicians may at times contribute to not completely full information or giving a perception to patient that is somewhat overstated.
Yeah, and I would only add that, Peter gave a terrific website to check out claims about COVID, newslit.org. You could also go to the AARP website, aarp.org/coronavirus to see the latest on the vaccine and the disease. So check that out. Jesse, who do we have up next?
Yeah, our next question is going to be Barbara from New York.
Hey, Barbara, welcome to our program. Go ahead with your question.
Hi, I wanted to know what bivalent stands for. You mentioned it in connection with the Pfizer vaccine.
Yep. Dr. Passaretti, can you talk about what bivalent is, the bivalent vaccine?
Yeah, so the initial COVID vaccines that came out just had one strain of COVID, the original strain in it. The updated version that became available within the past 6-9 months or so is bivalent, meaning it has that initial strain, but it also had Omicron strain. So bivalent means 2 different strains of variants are included with the vaccine with the intent of providing better protection against what's circulating at that point in time.
And that was the case, right? It did, in fact, provide better protection.
Yes,
okay. Very good. Thanks to all of you for answering our questions. It's been a really informative discussion. And thanks to our AARP members, volunteers, and listeners for participating in the discussion today. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. All of the resources referenced today, including a recording of the Q&A event, can be found at aarp.org/coronavirus beginning tomorrow, February 17th. We hope you learned something that can help keep you and your loved ones healthy. Thank you and have a good day. This concludes our call.